Look at your nails right now. Go ahead, look at them. Because what you're about to hear is going to change the way you treat them forever. Most people think nail care is about appearance, about looking clean, looking polished, looking put together. But your nails are not just cosmetic. They are biological sensors, living tissue. And the way you treat them, the habits you've had for years, maybe decades, could be silently damaging not just your nails, but your immune system, your nervous system, and in some cases, your heart. Today we are going through 10 nail care mistakes that doctors and dermatologists say are far more dangerous than most people realize. Some of these you are almost certainly doing right now, and by the end of this video, you will never look at your nails the same way again. Mistake 1. Cutting your cuticles. Let's start with the one that is done in almost every nail salon on the planet. Cutting your cuticles. It looks clean. It looks neat. Nail technicians do it with professional tools. So it must be fine, right? Wrong. Your cuticle is not dead skin to be removed. Your cuticle is a seal, a biological barrier specifically designed by your body to block bacteria, fungi, and viruses from entering the space between your nail and your skin. When you cut that seal, even with a clean, sterile instrument, you create a microscopic open wound, an entry point, and bacteria do not need a large opening to get in. Dermatologists have documented cases where routine cuticle cutting led to paronychia, a painful bacterial or fungal infection of the nail fold. In people with diabetes or compromised immune systems, these infections can escalate into serious systemic illness rapidly. The American Academy of Dermatology is clear on this. Do not cut your cuticles. Ever. Push them back gently with a soft tool after soaking in warm water if needed. But cutting them is a mistake that your body pays for. Mistake 2. Biting your nails. This one seems obvious. But the real reason it's dangerous goes far beyond what most people understand. Nail biting, medically called onychophagia, affects an estimated 20 to 30% of the general population. And the damage it causes operates on 3 separate levels. Level 1. Mechanical damage. Repeated biting physically deforms the nail matrix, the tissue at the base of your nail that controls how your nail grows. Once the nail matrix is damaged, nails can grow in permanently misshapen, ridged, or split. This damage can be irreversible. Level 2. Infection. Your hands touch more surfaces per hour than almost any other part of your body. Subungual bacteria, the bacteria living under your nails, include Staphylococcus aureus and E. coli. When you bite your nails, you are transferring that bacterial load directly into your mouth, your gums, and your digestive system. Level 3. Dental damage. The constant pressure of biting hard nail tissue causes microfractures in tooth enamel over time. Orthodontists regularly see nail biters with enamel erosion, misaligned teeth, and jaw strain that requires years of corrective work. And perhaps the most overlooked consequence, nail biting is now classified by the DSM-5 as an obsessive-compulsive related disorder. Empathetic. It is not just a habit. For many people, it is a psychological compulsion driven by anxiety, and treating only the nails without addressing the anxiety achieves nothing. Mistake 3. Wearing acrylic or gel nails continuously. Acrylic and gel nails are a multi-billion-dollar industry, and the damage they cause is almost never discussed at the salon counter. Here is what happens beneath those extensions. The application process requires roughing up the natural nail surface to create adhesion. This filing physically thins the nail plate, sometimes by as much as 30 to 40% of its original thickness. Every fill, every removal, every reapplication removes another layer. Over time, the nail becomes so thin and brittle, it can no longer protect the sensitive nail bed beneath it. Dermatologists call this nail thinning, and unlike a cut or a bruise, thinned nail plates do not fully recover quickly. It can take 6 months to a full year for a nail plate to completely grow out and restore thickness. But the structural damage is only part of the story. The chemicals used in acrylic application, methyl methacrylate and ethyl methacrylate, are known sensitizers. Repeated exposure causes contact dermatitis, a chronic inflammatory skin reaction that can spread beyond the nail to the fingers, hands, and in severe cases, the face, from touching your face with contaminated fingers. And the UV lamps used to cure gel nails? A 2023 study published in Nature Communications found that UV nail lamps caused DNA damage and mutations in human cells, the kind of cellular damage associated with cancer development. The researchers described the damage as similar to UVA tanning beds. One occasional gel manicure is unlikely to cause harm, but continuous use, reapplying every 2 to 3 weeks for years, is a cumulative exposure risk that the industry has been very slow to acknowledge. Mistake 4. Peeling off gel or acrylic nails. This one is extremely common and extremely damaging. Gel and acrylic removal requires acetone soaking for a reason. The bond between the product and your natural nail is designed to be strong. Peeling it off forcibly does not just remove the product, it removes layers of your actual nail plate along with it. Every time you peel a gel nail, you are physically stripping away the top layers of your nail. Nail specialists call this delamination, and it leaves the nail surface raw, soft, and completely vulnerable. People who regularly peel their gel nails often develop nails so thin and soft they bend on contact. The nail plate loses its structural integrity entirely. And because the damage is to the nail plate itself, not just the surface, it takes months of uninterrupted growth to repair. If you wear gel or acrylic nails, always have them professionally removed with proper acetone soaking. The extra 20 minutes of patience protects months of nail health. Mistake 5. Using nails as tools. Opening cans, scraping stickers, prying open lids, scratching off labels. Your nails are made of keratin, the same protein as your hair. And while keratin is resilient, it is not designed for mechanical leverage work. Using your nails as tools creates stress fractures in the nail plate, small internal cracks that weaken the entire structure. These fractures make nails prone to breaking at the worst possible angles, sideways breaks that extend into the nail bed, causing bleeding and intense pain. More seriously, using nails as tools on dirty surfaces dramatically increases the bacterial load under the nail. The subungual space, the gap between nail and nail bed, is already one of the most bacteria-dense areas of the human body. Adding contamination from random surfaces makes it significantly worse. And for people who work with food, care for children, or care for elderly relatives, the bacterial transfer risk from tool-use nails is a genuine public health concern. Mistake 6. Cutting nails too short. There is a precise, safe length for nail trimming, and most people cut past it regularly. The free edge of your nail, the white part that extends beyond the fingertip, exists for a biological reason. It protects the hyponychium, the skin beneath the free edge, from environmental exposure. It also prevents the nail from growing downward into the fingertip tissue. Cutting nails too short, especially at the sides, creates the perfect conditions for ingrown nails. Ingrown nails are not just painful. In severe cases, they become infected, requiring surgical intervention. In diabetic patients, an untreated ingrown nail infection can escalate to the point of threatening limb viability. The correct technique: cut straight across, leaving a small amount of free edge. Never cut down into the corners, and never cut so short the fingertip skin is exposed. Mistake 7. Ignoring nail changes. This is the most medically serious mistake on this entire list. Your nails are a diagnostic window into your internal health. Doctors have known this for over a century, and the changes your nails display can be among the earliest visible signs of serious systemic disease. Yellow nails can indicate lung disease, lymphedema, or thyroid disorders. Clubbing, nails that curve downward like the back of a spoon, is a classic sign of chronic low oxygen levels, often associated with lung disease or congenital heart defects. Pale or white nails can signal liver disease, anemia, or congestive heart failure. Dark vertical lines, called melanonychia, running from the base of the nail to the tip, can be a sign of subungual melanoma, one of the most misdiagnosed and dangerous forms of skin cancer. Bob Marley died of subungual melanoma that was initially dismissed as a soccer injury. Pitting, small dents across the nail surface, affects up to 50% of people with psoriasis, often appearing before any skin symptoms develop. Bose lines, horizontal ridges or grooves crossing the nail, indicate a period where nail growth was severely interrupted, often by systemic illness, major surgery, chemotherapy, or severe nutritional deficiency. Most people notice these changes and do nothing. They assume it is cosmetic. They paint over it. They file it down. If any of these changes appear on your nails, especially dark streaks, sudden clubbing, or nails that separate from the nail bed, see a doctor. Do not wait. Do not paint over it. These signs exist because your body is trying to communicate something. Mistake 8. Using harsh nail polish removers daily. Acetone is effective. It is also one of the most aggressive solvents your skin comes into regular contact with. Daily or near-daily acetone use strips not just nail polish, but the natural oils from both the nail plate and the surrounding skin. The nail plate becomes dehydrated, losing flexibility and becoming brittle. Brittle nails crack, split, and peel far more easily. And once the nail is dehydrated, it absorbs water from washing and releases it through evaporation, creating a repeated expansion-contraction cycle that weakens the structure further over time. The skin around the nail, the perionychium, also suffers. Repeated acetone exposure causes chronic dryness, cracking, and in some people, a persistent inflammatory reaction. Non-acetone removers are gentler, but still drying with daily use. The healthiest approach is to space out nail polish changes, use nourishing cuticle oil regularly, and allow nails periodic breaks from polish entirely to breathe and recover. Mistake 9. Skipping nail health during illness or nutritional deficiency. Your nails grow approximately 3 millimeters per month. That growth requires a continuous supply of specific nutrients, and when those nutrients are deficient, your nails are often the first place it shows. Biotin deficiency causes nails to become thin, brittle, and prone to splitting. Studies show biotin supplementation measurably improves nail thickness in deficient individuals. Iron deficiency, one of the most common nutritional deficiencies globally, causes koilonychia, where nails become thin and concave, curling upward at the edges into a spoon shape. Zinc deficiency causes white spots, Bowes lines, and slow nail growth. Protein deficiency, common in restrictive diets, causes the nail plate to thin and lose its natural luster. Vitamin C deficiency affects collagen synthesis, weakening the nail bed and surrounding skin. People on highly restrictive diets, recovering from serious illness, or going through prolonged stress, frequently experience sudden nail deterioration and dismiss it as cosmetic. It is not cosmetic. It is your body showing you its nutritional state in real time. Mistake 10. Not moisturizing nails and cuticles. The final mistake, and one of the simplest to fix. Nails are porous. They absorb and release water constantly. Without regular moisturization, nails dehydrate, becoming rigid and brittle. Dehydrated nails are exponentially more likely to crack, split, and peel than well-hydrated nails. The cuticle area is equally vulnerable. Dry, cracked cuticles are not just uncomfortable. Every crack is a potential entry point for bacteria and fungi. Hangnails, those small, torn pieces of skin at the nail edge, are almost always the result of chronic dryness, and tearing them creates open wounds that can become infected. The solution is simple and inexpensive. A daily application of cuticle oil, jojoba oil, vitamin E oil, or any nail-specific oil applied to the nail plate and cuticle area takes 30 seconds and makes a measurable difference in nail strength and health within weeks. Moisturize after every hand wash. Moisturize before bed. Wear gloves when using cleaning chemicals. Encouraging. These 3 habits alone will transform nail health for most people. Your nails are not decoration. They are living tissue, biological armor, and a direct reflection of what is happening inside your body. The 10 mistakes we covered today, cutting cuticles, biting nails, continuous acrylics, peeling gel nails, using nails as tools, cutting too short, ignoring nail changes, harsh removers, ignoring nutrition, and skipping moisturization. Every single one of these damages not just your nails, but your overall health in ways most people never connect. Start with one change today, just one. And if you noticed any of those nail changes we described, dark streaks, clubbing, sudden white nails, or horizontal ridges, do not ignore them. Make an appointment. Your nails may be telling you something important. If this video opened your eyes to something you never knew, share it with someone who needs to hear it. And if you want to learn what the color of your nails reveals about your internal health in detail, that video is right here. It will genuinely shock you. Subscribe, stay informed, and take care of the body you were given.